welcome to Healing Step to Wellness. I'm Dr. J,
I'm Mei.
your trusted guide to whole person health, one step
And one bite at a time.
at a time. Well, today we have the great honor to have Suzanne here with us.
Yes, she is so special. She is so special, not only to me, but also to the Lotus House Foundation.
Yes. That's with her help. That's how we got the Lotus Health Foundation, the first annual community wellness symposium and gala going.
That was way back to 10 years ago.
Yeah.
Yes.
Yeah, at the time that she put up the best bet, a risky bet, but also turned out to be, I hope that
it wasn't a risk at all. It was actually, I could see exactly the good work you were doing, and I knew it needed support.
Thank you. Well, Suzanne, thank you so much for joining us. Could you tell us a little bit about your background, where you grew up, what drew you first into community, nonprofit works, and also Minnesota?
Sure. Well, thank you so much, Jay and May. It's so nice to be here with you. Yeah, we met 10 years ago when I was working at the George Family Foundation, leading an initiative called Catalyst, which was designed to build integrative health and healing in community. And what Lotus Health Foundation was doing was exactly that. It was educating people. It was building critical mass of individuals and organizations and systems who are actually tending to their own well-being as a way of making the world a better place, as a way of fostering leadership that is compassionate and strategic. So I came into this work. I started working in the nonprofit sector in the early 2000s, and I'm a native Minnesotan. I was born in what is now White Bear Lake. It was before there was an interstate going out there, so that tells you how old I am. There was no interstate going past White Bear Lake at that time. And moved around a bit as a teenager and in my 20s, but came back to Minnesota because it is home, and I've been here ever since. So previously, I was the executive director at the Minnesota Indian Women's Resource Center. I came into that work as a survivor of domestic violence and as a person who thought I could give back to my community because of the experiences that I'd had and how I was able to find healing and move beyond surviving to becoming a thriving change agent. And it was through advocates, it was through my family, it was through a lot of support that I got. But I also know that when we have trauma in our lives, we can either let that define us or we can make that be part of the story that carries us forward. And so for me, moving into a job that was extremely difficult and very rewarding was a way for me to give back and to feel like I was using my some bad experiences to make some good come out of that. So at the Indian Women's Resource Center, and this is actually pertinent to the well-being journey, right? So the work in Indian country is it's really addressing historic generational trauma. American Indian people in this country were subjected to government and sometimes systemic efforts to eradicate them. Their children were stolen from the families. They were moved off their homelands. We won't go into the history, but American Indian people for generations have been traumatized. And so when we see generational trauma show up in communities today, simply slapping Band-Aids on those wounds is insufficient. And so the work that we tried to do then was to address the deep historic trauma through cultural healing. Because a lot of folks are not going to clinical mental health care. They have deep wounds, they have PTSD, they have anxiety. They live in a survival mode where their amygdala is lit up most of the time. And so how do we connect them with the healing ways of the ancestors? It's through language, it's through traditional foods, it's through ceremony, it's through learning practices that help them settle their central nervous system. We did some very difficult work around sex trafficking, understanding how American Indian women and girls were being sold into the slave trade, the sex slave trade. And that took a toll on my staff particularly, but also on me. And it became clear that the nonprofit sector that is doing the very hard work of addressing social, economic, human disparities, human pain and suffering, the people doing the work are sometimes really impacted because we all come into the work with our own gifts, our own wounds, our our habits, our practices. And if we don't have good self-care practices, it's easy to burn out. It's easy to make bad decisions. So we started to really invest in healing. How are we healing? How are we grounding ourselves in the traditional ways of the ancestors, which helped people thrive? The traditional food ways of people who lived on reservations, who ate a different food than commodity foods that they were given when they were moved off their sacred lands. So it was nutrition, it was ceremony, it was spiritual practice, it was social connectivity. There was a lot of information about how our central nervous system gets lit up and what that cortisol does within our system. And that was powerful. It was powerful individually for me as a survivor of violence, as someone who was carrying that trauma into my leadership and recognizing that I wasn't the leader that my organization needed me to be because I had not done my own deep work, and that I had to do that deep work in order to be a more effective leader. That was a very powerful time in my life. And in 2014, I was offered the opportunity by the George Family Foundation to lead the Catalyst Initiative, which is where I met you good people. Catalyst was seeking a way to support integrative health and healing in community. Bill and Penny George have a long history of investing in healing in ways that have meaning in community and trying to transform medical systems to be more whole person and preventive in their approach. I didn't know what the community wanted, and so they gave me a great gift, which was to ask people in community, what does integrative health and healing mean to you? What's the language you use around it? What are the practices that have meaning in your community? Who are your healers? How should we support that? And so the funding strategies that came out of that process was to invest in training, convening, and seed grants. And Lotus Health Foundation was one of those seed grant recipients, because we know that the folks doing the work know what's best in their community. They're the closest to the community need. They're the closest to the ancestral ways, to the practices that will be attractive and will be utilized by people. So I can come into a community and say, well, I'm going to teach you how to do yoga. But if people are like, yeah, yoga's not for me, that's not going to work.
That's right.
So the practice needs to reflect what the community is open to. And that's where I thought Lotus Health Foundation was so well positioned to do that work. So Catalyst did a lot of investing over 3 years and then moved over to the Minneapolis Foundation. I got some additional resources. We were able to do some additional investing because at that time it was still very new. Philanthropy was not recognizing, and I would say to this day, we still have some work to do, but philanthropy still doesn't quite understand how connecting our wholeness, our individual and our collective wholeness, is actually required for us to be warriors for peace, to be the most effective change agents that we need to be, to address the problems that we're all trying to fix in this society today. If we are depleted, if we are exhausted, if we are stressed out, if we are traumatized and we're just running 24/7, we're no good to anybody, really. We've gotten messages for years and years and years that you have to be available 24/7, you have to, exceed the demand, you have to just work all the time. And that is not helping us. So I left the foundation world in 2022 and started consulting. And my consulting work is really around trying to advance these concepts of healing-centered organizational cultures and leaders. How are we grounding our own healing work as leaders and in organizations and in sectors, quite honestly? But it is the work that will then allow us to flourish and create the thriving horizon that the next generations are hoping we will create.
Wow.
That's a long answer.
Yeah, but one thing that really struck me is talking about putting a Band-Aid on the wound.
Yes.
My fellowship training at Mayo was wound care. I love to treat wounds. And in the early days when I was treating wounds, sometimes the patients, even the facility staff say, we don't want you to see the wound because you get a wound bigger. I said, well, if you don't open up the wound, how do you heal it from within? You cannot just put a Band-Aid on top to try to heal the superficial wound. Now they have a better concept now, though. So it's very acceptable that we open up the wound. So, but the question is not just open up the wound. What are you going to do after you open it up? You don't want to get it just bigger and get worse from there. You need to have a plan after you open it up, you have a plan to heal it from within, from the bottom up, to really heal the wound. So exactly what we're doing the wound management.
Oh, well, hold on. Dr. J, allow me inject something. So if I understand you correctly, based on what I'm observed about your wound care protocol, you open up the wound and you need to do a great debridement in order to allow your cell to absorb whatever the nutrient, I mean, we're talking about nutrient, whatever the treatment that you want to apply to it, and then allow it to heal, grow new cell.
Right, but at the same time, it's just like Suzanne mentioned, it's a oneness, the whole person. Right? Don't just treat the wound, trying to hope the wound will heal. But if the person, the whole, is not ready, the body is not ready, it's not going to heal. So you have to look at the circulation, and measure they're eating good, measure diabetes control, anything like that, good nutrition, good exercise, good sleep, everything, just the whole thing, not just the wound itself.
Wow. Yes. Suzanne, what is your answer?
So, and I will first say that I think the medical system that we have in place today is fantastic in many ways. If I break a leg, if I have a heart attack, I want to go to the hospital. Like there's a huge role that clinical systems provide, and preventive screenings. There's a wonderful array, but we have created a medical system that is all about treating disease, not promoting wellness, because there's no financial incentive in the business model, right? So it is up to us. We need to educate ourselves, and the wounds are often invisible. And many times I think in the medical system, mental health system, social service system, because of the revenue streams, let's talk about Medicaid, for example. If a Medicaid billing is not sufficient to cover the cost of the service that you're providing, you have to have quantity, not quality. So you have to see more patients, which means if I come in with a complicated mental health issue, if I come in with a problem that's not easily resolved, I may or may not get the best care. So what we see happening in many cases is folks who are on Medicaid, who are on public assistance programs or don't have insurance, they are expedited in many ways. In many cases, it's simply due to the cost involved, and may not receive the thorough, sort of exploratory, like what is the source of this wound? I'll give you an example. I funded a program while I was at the George Family Foundation, and I still try and connect resources to many different programs doing good work like yours. And it was working with Somali women who had come from refugee camps. And there was one woman in this group, and they were teaching them about nutrition, about prayer as a way to settle central nervous system, about movement, like let's go to the mall and walk, all the ways that they can tend to their health. And one woman in the group had persistent heart problems, and she would go to the doctor and they'd put her on medication, and she'd go back to the doctor and she'd get more medication. She was on all this medication. And finally in the group, she's opened up one day about what happened to her children in the refugee camp. Her children were taken from her. It's a horrible story. But once she was able to open that up, like she opened that wound, she debrided the wound, right? She shared in a trusted, safe place with supportive people who were able to tend to her in the way she needed to be tended to. Her heart pain stopped. So she had heart pain because of her children's absence. But the good news is that the group was then able to tap into some connections, and they found one of her children. They never found the second one, but they did find one of her children. So that's a wound. It's not diabetes. It's not a broken limb. It's a soul wound. And in order to tend to that, you need trusted relationship. You need to be in a safe place where you can open up about that. But just from a clinical standpoint, from a cost-saving standpoint, she no longer is going to the ER with her heart pain.
Right. But just like you say, because of reimbursement, number one issue is reimbursement that favor procedures over just talk. Yeah, talk is really cheap in medicine. And secondly, just like you say, because the reimbursement is low, instead of quality, you have to talk about quantity. But when you talk about quantity, you sacrifice the time to really build relationship and even dig deeper into the question with your patients, and you're not able to address the root cause. And that's another issue with this type of reimbursement.
Right.
But then just like you say, it's self-care. I sometimes I'll honestly tell my patient that I cannot work harder than you. No matter what I can do, it's up to you. I just cannot work harder than you. So it's just like you say, so is that self-care is very important. I want to share one story. It's just like you talk about the volunteers or workers. When I just met more than 30 years ago, I was thinking about going to clinical psychology. And May asked me a question. Do you want to listen to old people's problems and cannot tell anyone about it? I'm just like, ooh, that's a lot. Okay, let's not go that route. I'm just not built for that.
She already knew you, right?
So, Suzanne, I also capture one thing that you elaborate here is the soul wound. The first time I heard it's a soul wound. How we open up that person's trauma, where that occur, and then truly some people they don't recognize they have a trauma even.
Yeah.
And even when we just had a conversation with Dr. B, the gut health doctor, and he mentioned that a lot of people they experience the gut health issue, and he reminded people, well, did you have this childhood trauma? Did you have this and that? And people normally don't realize it until think about it and say, oh, but when that person be able to go back to open and face it, then the problem gets solved, you know. So I do believe that our healthcare system right now, number one, maybe a lot of physicians don't have this kind of a training and knowledge to recognize that healing a person, not just a physical, to apply the medication, you know, focus too much on the medication, what is the best up-to-date medication. In addition to that, we also need to help this person, the emotional side, you know, take care of that part. So it's just a revolving door for healthcare providers like us. We want patients to get better, but as when we are facing the financial consideration need to rely on quantity, it truly also jeopardize providers as well, because as you already
Yes.
recognize that a lot of burnout, healthcare provider burnout. So the wound, well, is deeper than what we think the wound is.
My youngest sister is an ER nurse. She works with a lot of trauma. Folks are coming to the ER they're not at their best, right? Some of them are very, very ill or very damaged. And the system that she works in, I won't even mention the state she used to work in. She works in a different system now, but the system that she worked in did not take care of their nurses at all. They were very much stuck in a revenue generating mindset that required them to just move it. They were understaffed. They didn't get adequate breaks. They were working too long shifts. And so sometimes they're not doing the best job that they can do. COVID really showed us that the healthcare system doesn't take care of itself. Like the healers need healing. The healers need healing. That's true whether you're a medical professional, a mental health professional, a chiropractor, an acupuncturist, a ceremonial herbalist. The people caring for others, whether you're caregiving for an elder or a disabled family member or friend, the people who are giving the care that the state or the system should not or cannot need to be tended to. They need to have adequate resources. They need to be financially supported. Our system does not do that. And I would also offer, my personal opinion is that we're in the middle of a pretty significant systems collapse right now. Most every system, healthcare, education, governance, criminal justice, how's it all working out, right? Not working out so well. This is regardless of your political opinion. The systems were designed years and years ago. Our society has changed. The systems are no longer meeting the need. And so particular to our medical care, our mental health care, our well-being, the more that we can rely upon ourselves, the more the agency we have around being as strong and as resilient, the more we can boost our immune system in whatever way, that managing our stress, getting the right nutrients in our system, through spiritual care, whatever it is that we can do, we will be healthier people. Even if we have chronic disease, even if we're, like my father is 96 years old, he's going in for a hip replacement because he doesn't want to stop hiking. You know, I have that DNA. The more we can be active and participating in our own well-being, the better off we'll be. And the less we will have to rely upon a medical system that is under such strain right now.
Mm-hmm.
So I think one of the things that we can do to be most useful is to make sure that we are tending to ourselves in the most authentic and resilient way we can, so that we are the best relatives we can be. Like,
Yeah.
I'm not helpful to anyone if I have gut issues because I'm knotted up with trauma or stress. And the other thing I will say is there's I'm in a number of conversations right now about moral injury. And again, I'll use an example of when I was at the George Family Foundation, and one of the organizations we funded was working with veterans. And Paul Riedner, and I will use his name because I think he's still out there really trying to advance this care. Paul Riedner talked a lot about how veterans came back from Iraq or Afghanistan or wherever they were sent, and now we are in another war, right? So we have veterans, service members in these places, and some of them find the camaraderie, the shared purpose to be really meaningful, and then they come back to a country that is so divided and so angry at one another. And I remember him telling me, you start to wonder, what was that all about? And many veterans that I've talked to, and I have family members who are veterans of Vietnam and other wars, have said that they had to do things in those wars that damaged their spirit. They had to kill people. How do you do that and then come home and be whole? So to tend to the moral injury, I don't know if the VA is doing that. I don't know who's doing that, but it is a necessary part of being as whole as you can be, is to know when people are in a position where they're taking actions that are against their moral fiber. What harm is that doing to their soul? What harm is it doing to their spirit? And how do we help them forgive themselves and find their way forward?
Yes, that exactly what I had in mind. Through our lifestyle medicine education, one of the most powerful presentations, lectures we give up is forgiveness. Not just to forgive other people, it's how to forgive yourself. Yeah. That is a very powerful thing that we need to emphasize. And so when we talk about a system, when we talk about that, one thing that came to my mind is, back to the indigenous population, because we talked to the former president of Navajo Nation, Person Nets. And then we talk about from the Trail of Tears and to the how the government provided food to the indigenous population, to the nation, and how that food actually caused their health issues.
Yes.
And then how they can try to tap back the food, the stress, and heal themselves. But it also led to my curiosity how you got into the indigenous community.
Well, my grandfather apparently was a French Canadian and First Nations Abenaki man. Now, I never knew him. He died when my mom was a baby. I had a lot of family stories who would tell me these were Indian people from Quebec. I went to Abenaki Reserve. I asked them to help me, can we find anything? What they told me was that a lot of people in the 1850s, when my ancestors were living in that area, they registered in the census as French Canadians because there was so much racism.
Mm.
And then my great-grandparents had migrated into the New England area, which is where my grandfather was born. So I knew I had this connection. I can't prove anything. I don't have any documents. But my grandmother, my great auntie, I would hear these stories from them about, oh, your grandfather was an Indian man. He came from Quebec. So I felt a connection to that. And when the Indian Women's Resource Center opportunity came up, I was very clear about who I am and who I'm not. And that was both a blessing and a difficulty at sometimes because I was not from the community and I'm not an enrolled tribal member. And for some people, I should not be there. But I also relied heavily on my board and my staff and the community to say, you're doing a good job, and so stick around. And when the time is right, then you will leave. So I've stayed connected to the community very much because I also feel very blessed to be part of the connections to the community. I still work with the Birth Justice Collaborative, which is American Indian and African American project that started in 2000 and it was in 22. And it was partnered with Hennepin County to improve maternal health outcomes for Black and Native families. American Indian and African American women have the worst mortality rates in the state. In a state that has pretty good outcomes for most white women, Black and Native women still have very poor outcomes. The causes are complicated, but there are a lot of the reason is rooted in the historic trauma and the structural racism. There's a history of forced sterilization in both communities where medical systems would, without consent, without permission, would sterilize young women, right? So there's a lot of historic, systemic contribution to the problem we have today. And again, as I started out by saying, we cannot just put Band-Aids on these wounds without acknowledging it, without trying to rectify it in the ways that the community identifies, not necessarily the way that the system identifies. We'll never change anything. So for Native people in the cities, the urban Indian population in the Twin Cities here is one of the largest in the country. Nationally, I think 70%, 60 to 70% of enrolled Native people do not live on their reservations. They live in the cities, towns, where the jobs are. That's also an outcome of forced relocation programs from the 1950s. But the community here is very strong. It's very resilient. And it also has some of the deepest wounds. A lot of the encampments that we hear of, these are disproportionately Native people. Drugs are killing Native people every single day. At the same time that the federal government is cutting programs for drug treatment. So again, we have what the community sees as the need, and then we have what the system is doing. And ain't nobody coming to save us, right? So we have to find the ways that we can take care of one another. We've seen this amazing thing happen here in Minneapolis with the Metro Surge, the occupation of the Immigration and Customs Enforcement. So whatever you think about that, there was great harm done to families. 2 people were shot to death. Citizens were scooped up, taken down to the Whipple building, denied their civic rights. But what happened, the good news is that people saw the need to care for their neighbors. People saw the need to tend to our community, that sort of mutual aid. Do you have enough food? Do you need a ride? People weren't going to their medical appointments. They weren't going to school. They're still not going to work. Businesses are closing. But people begin to look out for one another because we know that together we have to take care of one another. And so that gives me a lot of hope. I'm very proud of the way Minneapolis stood up and hope that this sense of sort of mutual responsibility doesn't just go away. That was a lot. That was much more than you asked for, wasn't it?
Well, it's it's very deep, Suzanne. This is the first time that we had such a deeper conversation, and well said. I really appreciate that you really look at the community and involved with the community work, and that's so deep, even deeper than what I thought.
I think last summer we did a project in the Twin Cities. We were doing the lifestyle medicine education to a group of people who were really released from prison. So they were mostly just addiction issue. And among a group of a bit more than 10 people, there were 2 from the nations. One was, I believe was from the vocabulary. Yeah, so there were 2. And one of them actually told me that he had been in prison since he was 12 years old with all those issues. And just like you say, we cannot just try to treat that. This really from self-care, from resilience. And when you talk about the cost, and something come to my mind is this, our current health system was designed to treat acute care. Just like you say, you break a bone, you have something, injury. The system was designed to fix that. But now the vast majority of the cases are related to chronic diseases.
Yeah.
It's not really the quick fix can really fix it. And that's how we not only the health spiraling down, but also the cost is getting higher and higher because we're just not able to treat the root cause. And so that is really important for your work to go to the communities, raise awareness that people can do more self-care. So are there any self-care initiatives, projects, services you're involved right now?
Yes, there certainly are. And so, you may know more about this than I do, but my understanding is that there's a direct correlation, not necessarily a causation, but a correlation between toxic stress and chronic disease. I've read that something like 80% of chronic disease can be traced to toxic stress or trauma. So to me, that's another imperative for why we need to take care of our own health, because of the heavy chronic disease load that we have in this country right now, which I won't go into it because you know way more about it than I do. A lot of it is fast food and junk food and the stuff we've been sold and big cattle industries that are pumped full of antibiotics, like all of that, the stuff that we're sold that's cheap and easy. But the role of stress, and toxic stress particularly, stress is part of life. We all have it. But the capacity to manage it, move through it, release it, nobody talks about this stuff. So when I started learning about my amygdala, when I was at the Indian Women's Resource Center, and we were really starting to see, there's a lot of trauma in this organization, there's a lot of trauma in this community. I'm carrying my own PTSD into it. What do we do about that? Because we're not going to go to therapy for this. Many people do, and that's great, and it should be more available. That's another problem that I'm not qualified to fix. But what are we doing about our stress load? So there are ways that we can address it on an individual and organizational level. And right now I've been working on a project for the last, not quite a year, about 9 months, and we're going to renew it and go into another year with Youth Prize. And it is to address organizational stress, because we know in the last couple of years that resources have diminished for nonprofits at the same time that the demand in community and the urgency of the need in community has risen. So the nonprofit sector is on the front lines of trying to provide housing and trying to provide food assistance and trying to provide parenting training and all of the things that people need. Medical care, the community clinics, the FQHCs. The need in community is greater and the funding is shrinking. There are ways that we can think about how the capacity of an organization is very strongly correlated to the capacity of the individuals within an organization. I think about it as an organism. If my body has healthy cells and healthy organs, I'm a healthy whole body person. If I have disease cells, if I have spleen issues, if my organs are not healthy, I'm not a healthy person. So to think about an organization in that way, like if the leadership and the staff and the board, if the individuals within the organization are as robust and resilient and well-rested and compassionate and strategic as they can be, you have a much stronger nonprofit organization. Now, funders That's what they want to support. We want capacity in the nonprofit sector. And won't go into, there's a whole lot of problems within the nonprofit sector, just the way it's designed. But the established organizations that are doing the work that government cannot nor should do need to have more support. They need to have a business model that actually resources them to do the work. But that also requires that they are taking time to tend to themselves, that they are not working 70-hour weeks, that they are not putting their phone next to their bed on call, unless that's a clear part of their job for a limited amount of time. So the stress of the work starts to show up in staff turnover is primary. People just get burned out and they leave, or they're calling in sick quite a lot, or they're not making good decisions with their clients. So the project that I'm working with Youth Prize right now is to bring organizational well-being. There's some small grants that they're offering, and then some trainings that I'm doing with a team of trainers. It's just sort of introduction to human central nervous system 101. Here's your amygdala, here's your prefrontal cortex, here's what happens when you're in fight or flight, all the cortisol that's being dumped into your body. Here's some things you can do about that. And opening up the awareness, opening up the conversation, and then allowing people to decide, do I want to go deeper with this? Do I want a different trainer? Do I want to take some train the trainer certification program? Do I want to bring in a massage therapist for my staff? There are many different ways that it can show up. The community organizations should decide what that looks like and to give the resources to them so that they can experiment, try something until they find the thing that this works. These are the trainers we want to work with. This is the program. We really like this program. We want to build the capacity within our organization to have, for example, an elder in residence on staff or a healer in residence on staff, where that person is just there to provide guidance, spiritual care, deep breathing, help settle central nervous system. I'll give another example. At the Indian Women's Resource Center, we had some funding from the George Family Foundation, actually, to begin to build this in. And so one of our dearest elders, who is a beautiful healer, a ceremonial herbalist, became the elder in residence at the organization. Staff could go to her if they were feeling anxious or they just had a very difficult day, and she would help them breathe, going into their settling mode, guided imagery. She would talk to them about, what have you eaten today? Have you been hydrating? Are you drinking too much coffee? Like, just to help them get settled. The clients in the program could come and see her. She could hold group sessions so that 10 or 20 women could sit together and just breathe together, guided meditation, prayer, ceremony. The community could come in and see her. So that was her job, to do that. So that's just one of the things that's happening here. There's a lot of other work happening. I don't want to take up the whole time just with that, but I get very excited about the possibility of investing more in just helping the organizations on the ground doing the work to do more of that, to do more of that healing work. They are then going to be more resilient. They are then going to be more able to take on more work. They're going to be more creative problem solvers. They will be strategic. You cannot be strategic if you're in your fight or flight mode.
Mm-hmm.
Right. Mm-hmm. Stress is a huge issue in our current society. And yeah, that's a big one. And I'm also glad that you mentioned about the brain, those executive decision-making process. Now, we need to make sure our brain is really healthy. And there is an organization in Rochester talking about drug addiction to the youth, to the kids. And I was listening to her talk a few days ago, and she had a very good example. He asked, how many of you were learning swimming? How many of you were teaching your kids to swim? Because you don't want them to drown. You don't want to drown. But how many drowning deaths in Minnesota last year? 55. But how many deaths from overdose in Minnesota last year? 900.
Yeah.
So why are we focusing on swimming and ignore or not seeing the other big issue? But that's all a lot of them is coming from information and how you make the executive decision. So the brain, frontal lobe, that's very important. It's part of our lifestyle medicine education too. So yes, that's a pretty good area we have to focus on.
But I think we're sort of on the cutting edge still. Like when I started doing this work at the George Family Foundation and met you and you were doing this, so there's more people now in this space of recognizing that we need to work together to tend to one another, to tend to ourselves so that we're more effective in our work. But there's still a lot of work that needs to be done, educating people, advancing this as a priority, making sure that it's not seen as a luxury. So I think the more of us that are doing this work and the more we're talking about it, like this podcast, any way we can to get people to think differently about the importance of being as whole as you can be so that you may be the most helpful, the most strategic, the most compassionate, whatever your role is in your life.
Yeah.
I think it's even in the ancient Chinese teaching, the first thing is taking care of yourself. Not only you will be able to help other people, but at least no one needs to take care of you.
Yes, yes. I mean, and sometimes almost all of us, I would say at some point in our life, we need to be cared for.
Right.
But I use the imagery of a herd of bison, which my teacher shared with me, and it meant so much to me. And I share it a lot. So a herd of bison on the prairie are grazing, the conditions are favorable, and they see a storm coming off to the west, and they will try to avoid it. But once they see that the storm is upon them, they will come together as a herd and they will move intentionally into the storm, knowing that they will emerge intact on the other side. The herd forms a protective barrier. So the strong animals are on the outside, the babies, the elders, those that need to be cared for are on the inside. And in that way, the herd is intact. But that relies on a critical mass of strong individuals. There's always going to be someone who needs to be tended to. Maybe it's me, maybe it's you, but we need those strong individuals. So to me, this is an imagery that combines the individual healing with the collective healing. If we are to be a robust society, or we think about it as an organization or a community or even a family unit, it requires strength at some level so that those who need to be tended to and cared for can actually get that support that they need.
I like the way that you describe that right now, the healing, whether it's emotional or physical healing, that it should be the individual and collective healing work together. And that is the reason we feel like, in, it's great that we treat one person at a time, give them attention at an exam room. However, there are so many people out there that need to hear all this information, how we can bring bigger impact, more efficient. And that's what it takes. Organization, the strong leadership as a group, like a board member, as you mentioned, is so important to have a healthy board, the board of director, to lead the organization. So that's why it is kind of a bitter and sweet that when we have the nonprofit organization Lotus House Foundation to work on the community of wellness initiative. 10 years ago, when we didn't know what we were doing about this, we don't know where will that take us to. But over a period of time, we gradually seeing people from the medical world, from the community, they start recognize the importance of this work and they join us. And so that's the rewarding part. That's what I kind of experience to share. But of course, we all have our challenges. So we just have to press it and then finding the joy and purpose. So which is kind of it's kind of a related to my next question to you is hearing all this great work that you have done, but you also have some very challenging day. You face the difficulty. How do you find yourself to pick yourself up, give yourself a more the kind of motivation that this is worth my time. I'm going to keep working on this?
That's a really good question. I have over the last years, maybe a dozen years or so, really developed daily practices to keep myself grounded. Now, I miss days. Sometimes I miss a week. If I'm traveling, I don't sit in meditation. I don't often practice my Tai Chi. Sometimes I eat crap and I shouldn't eat it. Like, that's just the way it goes. But I have good practices and I have good teachers. And I surround myself with love because it is what is required to carry on these days. So I also am a continual learner. So I read a lot of inspirational books, new teachings. I participate in something called collective acceleration, which is a sort of a somewhat global group of people who are coming together to figure out how are we becoming who we need to be so that we can meet the needs of the next generation? How can we create the world that the next generations will need to live into, that I won't live to see, but I'm going to do my bit to get there. So I'm guided by purpose. And as I've gotten older, I have really begun to know what is the energetic gift that I get from my work, and what do I just not need to spend time doing anymore. Right? To make the choices get sharper as you get older. And I really make choices around doing the work that is meaningful to me, that I feel is useful in the world, that can help someone else. And I don't get involved in drama. I don't take on projects that I'm not well suited for, because that's just an exercise in futility and I get tired and crabby. So I make good choices. I try to make good choices. And I acknowledge that I don't always succeed, but I think that is about the forgiveness of self, right? Sometimes I mess it up and sometimes I get it right.
Yeah, it's just like me. I have very good supervisor. No, that's how it goes. But
I bet I know who that is.
Dr. J, we work together. I always come after you because the cooking always come to second.
Yeah. Okay. So I think that the main point is we need to have a good self-care, take care of ourselves. But then it's the purpose, why you want to take care of yourself, why you want to wake up in the morning. So it's just like when you mentioned about your 96-year-old father, and it reminded me a patient I had. I was talking to him and he was telling me his history. And when he turned 100, he just suddenly feel weak. He didn't know what was going on. So he went to see his primary care doctor. And the doctor said, you need a pacemaker. And he told me that he just looked at the doctor and said, what are you waiting for? He just want to keep going. Not so much life in front of him. He just want to keep going. That's a spirit we really need.
You know, aging it presents a whole different set of challenges. And I think when you're young, it's easy to carry on, to party, to burn the candle at both ends, to do all that stuff. When you start getting older and all that catches up with you, all those injuries that you were crazy doing stuff, and the need to really tend to your brain and to make sure that you're as cognitively sharp as possible. This all starts earlier in life. And most people aren't aware of it. When they're in their 20s, they're in their 30s, they're busy raising a family, getting ahead in their careers. They have other priorities. And somehow the message needs to reach them that what you do, the seeds that you're sowing right now are going to come around. And the more you are protecting your own health and being as strong and robust as you can be, it will pay off for you in the end, because you don't want to end up in a debilitated state when you're older. I look at my dad and he's out hiking and the mountains, and he works out in the gym, and now he needs a hip replaced. He's like, well, yeah, let's get the hip done because I got hiking still to do. Snowshoeing is coming up next year. We didn't have any good snow this year, so
okay, that's
it's just like just like you say, the kids in their 20s, 30s, they're having a good time or best time of their life. They don't know what's going to happen next. But at the same time, I just couldn't imagine you having parties, anything like that. It's hard to imagine.
Well,
Well, one thing I do want to mention that Suzanne, I want to rephrase that you mentioned about the love, surrounded by love. And that is so important as when I remember when we went attend your several convening couple years ago in the Twin City.
mm,
And one thing really touched me, gave me a big impact is you normally intentionally to design activity to have a round circle, to have a group, form a round circle, and then to turn around, say nice thing, one thing nicer to your neighbor, and then pass on, and to have the hug and touch, and that human touch make a huge difference. And it just sometimes just makes your nerve kind of ticklish. It's just like, wow, so nice that just get a nice shock by the love. So I want to acknowledge that.
I'm
That's
so glad
article.
you read. Those were Marnita's table events that we
Yes.
held, and that she's still doing great work, bringing people together across race, class, identity, connecting people in such a beautiful way around food, around, shared humanity. But I think part of the problem is our phones, right?
Disconnect. Yeah.
We are so, people don't talk to one another. They don't sit down for a meal together because the technology has taken over. So we have to be intentional.
Yeah.
And I think this, our brains are wired for survival. We are
Yeah.
human species. We're wired to survive. And so we're always scanning for the threat, Where's the bad thing? We have to be intentional about nurturing that goodness, about nurturing that connection and the forgiveness and the compassion for one another. That doesn't just happen. Well, for some people, I think it's easier than others, but many people it needs to be intentional work that we do, developing a discipline around it so that we actually have it as part of our daily experience in some way.
Yeah.
Yeah.
So nice.
Okay. So, well, we have talked so much. So what one insight or piece of encouragement would you share with listeners who would really like to make an impact in the community's health and wellness?
Well, I would say if you are connected to the Lotus Health Foundation, if you're in Rochester, you should be connected with these good people because they are doing amazing work. And if you're not there, you can always find people in your community. I think there's good work happening everywhere. And it starts with an intention. It starts with a desire to know something different, to know a different way. And you don't have to be, you don't have to be in so much pain that you can't even imagine a better way. You can start right now today. Every moment of your life, you have an opportunity to take a breath.
Yeah.
To think about a gratitude that you may want to express to someone, to offer forgiveness to someone. There's so many opportunities for us to make choices about what is within our control. And what is within our control is this, this, what we think, what we eat, how we sleep, all these ways. So I think that the growing awareness that you are helping to spread this awareness that I'm doing, that other people are doing, is what we need. And so I really appreciate you. I appreciate your work. I'm looking forward to joining you at your conference coming up soon. And I know you're going to talk about that, right?
Yeah.
Yes,
Okay.
yes. That's April 9th and 10th at the Mayo Civic Center right here in Rochester, Minnesota. You can check it out at lotushealthfoundation.org and look at Symposium.
And Suzanne also is going to be our panelist on April 10th afternoon to have a conversation about how to, the work in the community and promoting the wellness in many communities, different communities in Minnesota.
Yes, I'm looking forward to it.
Yeah.
I haven't seen you for a long time, so I'm looking forward to giving you a hug.
Wow.
Yes, can't wait.
Thank you, Suzanne, for sharing your journey and insight. You have helped us to see how the healing justice and this culture and leadership all play an important role in this whole person community wellness and health. So how would people can get in touch with you and learn more about you?
They can go to my website, catalystnorth.org, or they can Google my name, Suzanne Koepplinger. If you Google me, my LinkedIn page will take you over there, and happy to hear from people.
Great. Thank you. Thank you very much.
Thank you both.
Yeah.
All right.
Well, thanks for joining us on Healing Step to Wellness. I'm Dr. J.
I'm Mei.
Guiding you toward
Bye.
whole person health, one step
One bite at a
at a
time.
time. See you next
Thank
time.
you. We'll see you next time. Yeah.